Hello, my name is Paul Ernest. I'm a practicing ophthalmologist. I've been practicing for almost 30 years. I would like to talk with you about cataract and cataract surgery. What is a cataract? A cataract is the lens of our eye becoming cloudy. The human lens sits behind the pupil. It's about the size of an M&M candy, and over time it can become opacified. When the lens becomes cloudy, it obstructs our vision. The treatment is to remove the cloudy lens and replace it with a clear lens. We must put a lens back in the eye to take the place of the lens we remove. Think of a camera. If you take the lens out of the camera and do not replace it, the camera will not function. The entire procedure is done through an incision of about 1/8 of an inch. The incision is made in a special way that requires no stitches. I'm the pioneer of that technique. I've had the pleasure of teaching it many times worldwide. I've also had the pleasure of taking care of more than 65,000 patients. One of the greatest inventions for cataract surgery that we have now is a laser called the LensX laser. I use this laser in 3 parts of the cataract operation. The cataract has a thin capsule surrounding it, the consistency of a thin piece of cellophane. My job is to make a circular opening through that cellophane capsule. I've obviously had a lot of experience making circular openings through capsular bags. No human being can make an opening as precisely as a laser. The laser makes the opening more precise in size, shape, and centration. So then when you put a lens back into the capsular bag, after the cataract is removed, it too is precisely centered. It gives the patient the maximum optical properties that the lens was designed to give. This is really important when we use all lenses, but especially the multifocal lens. The multifocal lens has a series of prisms on the surface. This lens has to be precisely centered. If it has a slight tilt or a slight shift, you're not going to get the quality of vision you want, and you may even get adverse visual effects. The second thing that the laser does is to take the lens itself and break it up into small pieces. And by pre-treating the lens, it allows the surgeon to remove its contents with half the power that it would otherwise take. And by using half the power, we also use half the energy, which makes the cornea clear and the retina clear. And in patients with pre-existing disease of the cornea, such as Fuchs dystrophy, it makes the surgery safer. Finally, the LensX laser would treat pre-existing astigmatism. Astigmatism is basically the front of our eye, shaped like a football and less like a baseball. Astigmatism causes distortion in our vision. If you look at an eye chart, which has the effect of astigmatism only, you will see that astigmatism of a power of 1 will cause distortion in our vision compared to astigmatism of 0. What the LensX laser does is it takes the front of the cornea, shaped like the football, and place relaxing incisions on its surface, changing the shape of it from a football to a baseball. This in turn makes the patient less dependent on glasses for their distance vision or near vision. I encourage you to ask questions. I also encourage you to bring family members in with you so they can hear the explanation firsthand. I'm looking forward to our examination. Thank you.
Cataract surgery and/or implantation of intraocular lens IOL consent. What is a cataract and how is it treated? The lens in the eye can become cloudy and hard, a condition known as a cataract. Cataracts can develop from normal aging, from an eye injury, or if you have taken medications known as steroids. Cataracts may cause blurred vision, dulled vision, sensitivity to light and glare, and/or ghost images. If the cataract changes vision so much that it interferes with your daily life, the cataract may need to be removed. Surgery is the only way to remove a cataract. You can decide not to have the cataract removed. If you don't have the surgery, your vision loss from the cataract will continue to get worse. How will removing the cataract affect my vision? The goal of cataract surgery is to correct the decreased vision that was caused by the cataract. During the surgery, the ophthalmologist, eye surgeon, removes the cataract and replaces the human lens with a new artificial lens called an intraocular lens, or IOL. Cataract surgery will not correct other causes of decreased vision, such as glaucoma, diabetes, or age-related macular degeneration. Most people still need to wear glasses or contact lenses after cataract surgery for either near and/or distance vision and astigmatism. What types of IOLs are available? Your ophthalmologist will help you decide on the type of IOL that will replace your cloudy human lens. There are IOLs available to treat nearsightedness, myopia, farsightedness, hyperopia, and astigmatism. IOLs usually provide either near or distance vision. These single-focus lenses are called monofocal IOLs. Some newer IOLs can provide for near, intermediate, and distance vision. These multiple focus lenses are called multifocal premium IOLs. IOLs that treat astigmatism are called toric IOLs. You can also have one eye corrected for near vision and the other for distance vision, a choice called monovision. What is astigmatism? Are there other treatments for it? Patients with nearsightedness and farsightedness often also have astigmatism. An astigmatism is caused by an irregularly shaped cornea. Instead of being round like a basketball, the cornea is shaped like a football. This can make your vision blurry. In addition to toric IOLs, astigmatism can be reduced by glasses, contact lenses, and refractive surgery, LASIK or PRK. There is also a procedure called a limbal relaxing incision, LRI, which can be done at the same time as the cataract operation, or as a separate procedure. A limbal relaxing incision, LRI, is a small cut or incision the ophthalmologist makes into your cornea to make its shape rounder. Any attempt at astigmatism reduction could result in over or under correction, in which case glasses, contact lenses, or another procedure may be needed. Need to stop wearing contact lenses prior to surgery. If you wear contact lenses, you'll be required to leave them out of your eyes for a period of time prior to having surgery to allow the cornea to return to their natural shape. What are the major risks of cataract surgery? As a result of the surgery and associated anesthesia, it is possible that your vision could be made worse. In some cases, complications may occur weeks, months, or even years later. These and other complications may result in poor vision, total loss of vision, or even loss of the eye in rare situations. Depending upon the type of anesthesia, other risks are possible, including cardiac and respiratory problems, and in rare cases, death. Although all of these complications can occur, their incidence following cataract surgery is low. Risks of cataract surgery include, but are not limited to, complications of removing the natural lens may include hemorrhage, bleeding, rupture of the capsule that supports the IOL, perforation of the eye, clouding of the outer lens of the eye, corneal edema, which can be corrected with a corneal transplant, swelling in the central area of the retina, called cystoid macular edema, which usually improves with time, retained pieces of lens in the eye, which may need to be removed surgically, infection, detachment of the retina, which is definitely an increased risk for highly nearsighted patients, but which can usually be repaired, uncomfortable or painful eye, droopy eyelid, increased astigmatism, glaucoma, and double vision. These and other complications may occur whether or not an IOL is implanted and may result in poor vision, total loss of vision, or even loss of the eye in rare situations. Additional surgery may be required to treat these complications. Complications associated with the IOL may include increased night glare and/or halo, double or ghost images, and dislocation of the IOL. Multifocal IOLs may increase the likelihood of these problems. In some instances, corrective lenses or surgical replacement of the IOL may be necessary for adequate visual function following cataract surgery. Complications associated with local anesthesia injections around the eye include perforation of the eye, destruction of the optic nerve, interference with the circulation of the retina, droopy eyelid, bruising, double vision, respiratory depression, hypotension, cardiac problems, and in rare situations, brain damage or death. If a monofocal IOL is implanted, either distance, reading glasses, or contacts will be needed after cataract surgery for adequate vision. Complications associated with monovision. Monovision may result in problems with impaired depth perception. Choosing the wrong eye for distance correction may result in feeling that things are the wrong way around. Once surgery is performed, it is not always possible to undo what is done or to reverse the distance in near eye without some loss of visual quality. Complications associated with multifocal IOLs. While a multifocal IOL can reduce dependency on glasses, it might result in less sharp vision, which may become worse in dim light or fog. It may also cause some visual side effects such as rings or circles around lights at night. It may be difficult to distinguish an object from a dark background, which will be more noticeable in areas with less light. Driving at night may be affected. If you drive a considerable amount at night or perform delicate, detailed, up-close work requiring closer focus than just reading, a monofocal lens in conjunction with eyeglasses may be a better choice for you. If complications occur at the time of surgery, a monofocal IOL may need to be implanted instead of a multifocal IOL. Complications associated with limbal relaxing incisions, LRIs, astigmatic keratotomy, AK. Limbal relaxing incision and astigmatic keratotomy are surgical procedures to reduce astigmatism. Some complications associated with these procedures are surgical perforation of the cornea, infection, overcorrection and undercorrection. In the immediate postoperative period, refraction may fluctuate. Additional surgery may be necessary to reverse overcorrection or undercorrection. If an IOL is implanted, it is done by a surgical method. It is intended that the small plastic, silicone, or acrylic IOL will be left in the eye permanently. If complications occur at the time of surgery, the doctor may decide not to implant an IOL in your eye even though you may have given prior permission to do so. Other factors, such as pre-existing conditions, may affect the visual outcome of cataract surgery, including other eye diseases such as glaucoma, double vision, diabetic retinopathy, age-related macular degeneration, the power of the IOL, individual healing ability, and, if with certain IOLs, the function of the ciliary focusing muscles in your eyes. The selection of the proper IOL, while based upon sophisticated equipment and computer formulas, is not an exact science. Any pre-existing refractive corneal surgery may affect your outcome. After your eye heals, its visual power may be different from what was predicted by preoperative testing. You may need to wear glasses or contacts after surgery to obtain your best vision. Additional surgeries such as IOL exchange, placement of an additional IOL, or refractive laser surgery may be needed if you are not satisfied with your vision after cataract surgery. The results of surgery cannot be guaranteed. If you choose a multifocal IOL, it is possible that not all of the near and intermediate focusing ability of your eye will be restored. Additional treatment and/or surgery may be necessary. Regardless of the IOL chosen, you may need laser surgery to correct clouding of vision. At some future time, the IOL implanted in your eye may have to be repositioned, removed surgically, or exchanged for another IOL. If your ophthalmologist has informed you that you have a high degree of hyperopia, farsightedness, and/or that the axial length of your eye is short, your risk for a complication known as nanophthalmic choroidal effusion is increased. This complication could result in difficulties completing the surgery and implanting a lens, or even loss of the eye. If your ophthalmologist has informed you that you have a high degree of myopia, nearsightedness, and/or that the axial length of your eye is long, your risk for a complication called a retinal detachment is increased. Retinal detachments can usually be repaired, but may lead to vision loss or blindness. Since only one eye will undergo surgery at a time, you may experience a period of imbalance between the two eyes, anisometropia. Surgery in the second eye can be accomplished once the first eye has stabilized to reduce imbalance. These and other complications may result in poor vision, total loss of vision, or even loss of the eye in rare situations. You may need additional treatment or surgery to treat these complications. This additional treatment is not included in the fee for this procedure.